and welcome to the Good Health Podcast. I'm your host, Nicole Good, a registered nutritional therapy practitioner and functional medicine practitioner. Join me as we explore thyroid, brain, and fatigue conditions with positivity. From Hashimoto's to multiple sclerosis, chronic fatigue to adrenal dysfunction, I've got you covered. With expert advice and tips to help you take action now and inspiring real patient stories from successful individuals who refuse to let their health hold them back. Start your journey to good health today. And don't forget to come and join the conversation on Instagram at good_health. That's GOODE. Or visit my website at nicolegoodhealth.com to find out more. Welcome to today's episode of the Good Health Podcast. Today we're going to be looking at navigating thyroid diagnoses. So pretty much every single thyroid patient that I've worked with has said either one or multiple of the same things to me. They feel like they've been let down in their care. That's the big one. From a functional medicine perspective, individuals with thyroid disorders often find themselves feeling sort of let down in many of the critical areas. So including things like accuracy of diagnosis, available treatment, lack of focus on the whole body, or an investigation into the primary underlying factors. In fact, many of the people that come to see me don't know whether they've got hypothyroid or Hashimoto. They're not sure if they've got autoimmune disease. Some people know they've got Hashimoto's, but autoimmune disease have never been explained to them. But let's first take a look at why you might be feeling hopeless or let down in your care if you've got a thyroid issue. So the first reason is often inadequate testing. So generally people have had a limited range of tests. Conventional medicine particularly often relies on a very narrow set of thyroid tests, typically TSH. Sometimes you'll get your free T4 as well. And functional medicine advocates for a more comprehensive panel. So we do free T3, we do reverse T3, we do thyroid antibodies, so your TPO and your TG antibodies, as well as the TSH and the free T4, to get that complete picture of thyroid function and autoimmune activity. And that's really important. The other thing with testing is reference ranges. So the standard reference ranges that are used in conventional medicine may not actually capture subclinical thyroid issues. So testing within conventional medicine is designed to pull up when you've got damage, to the thyroid or to any part. This goes for all testing. So generally what they're looking for is the point where you reach disease state. What we're doing in functional medicine is actually looking to catch things earlier. We don't want to leave you until you get damage. We don't want to leave you till you get to that point. So the reference ranges sometimes are not capturing those subclinical thyroid issues. They generally focus on what the average person needs in order to get a diagnosis, but we want to really catch you before that. So we generally use narrower, more optimal ranges to identify and address those imbalances earlier. The next thing really is that sort of symptom management. So focus on numbers, not symptoms. So the conventional medicine approach may prioritize bringing those lab values into their normal range. And remember, this is that standard reference range that they class as normal. And sometimes this will actually kind of disregard whether or not you've got persistent symptoms going on. So in functional medicine, what I'm doing is we're emphasizing the importance of symptom resolution and quality of life alongside those lab results. So your lab results, that normal range is quite wide and your lab results might come back as normal. But if you're still experiencing symptoms, you're not okay. It's not normal and we shouldn't just accept them. The next thing is that root cause investigation. So conventional medicine focuses on treating the disease once you've got it, usually with medication, so some sort of synthetic thyroid hormone. But they don't really kind of explore those underlying causes. In functional medicine, what we're doing is looking deeper to the potential root causes. Are there nutrient deficiencies? Are there gut health issues? Are there chronic infections? Are there environmental toxins built up? So many different things that can lead to and be a root cause of thyroid conditions. And this is not to say that you don't need the medication. I work with many doctors on thyroid cases and many of my patients are on meds. What we're saying is that's one part of the picture. But just because you're on medication, it's not the end of your story. There's a lot more that you can do. Also, autoimmunity comes into this. So many thyroid issues, Hashimoto's thyroiditis, Graves', they've got that autoimmune component that conventional medicine doesn't really address. The medication that's given to you doesn't address autoimmunity. So functional medicine seeks to modulate that immune system, reduce those autoimmune triggers. And if you're just taking medication, you really are just looking at one part of the puzzle, particularly if you've got that Hashimoto's or Graves. And 90% of hypothyroid cases are Hashimoto's. So if you haven't specifically been told that you've not got Hashimoto's, then you really need to investigate whether or not you do, because most people do have Hashis if they've got hypothyroid. Similarly with hyper, many will have Graves as well, and may or may not have been told. Then we have that sort of holistic approach. So conventional medicine doesn't really look at lifestyle factors, things like diet, stress, sleep, exercise, and all of these things can really significantly impact thyroid health. So in functional medicine, we're going to be incorporating these elements into your plans. We're also really keen on individualized care, so a personalized approach that is based on your unique biochemistry, your lifestyle, your health history. There is no one size fits all. It's not just a case of we give you the medication and that's it. We're going to look at your health history. We're going to look at your story. That's going to be different from somebody else's with the same diagnoses. So the root cause of your problem may be different to somebody else who's got the same diagnosis as you. But your plan for healing may be very different. There is no thyroid diet. If somebody is giving you a thyroid diet, they're wrong. It doesn't exist. Depends on what your root causes are for you. I could have 5 patients in front of me, all got Hashimoto's, all got the exact same diagnosis, all been given the same medication. The root causes may all be different, and I may put them on a completely different plan. So that's really important that we've got this holistic and individualized care. Also with conventional medicine, they're not looking at diet. So we've said they're not looking at lifestyle. They're generally not looking at diet either. Most patients that come to me have not had any sort of really specific dietary advice. Some of them may know about eliminating gluten because they've read about it online, but really, they're not really doing any more than that, or they haven't been told any more than that of the other thyroid supportive nutrients that are required by the body or required by some of the other parts of the body that are linked in with your thyroid. So maybe if you've got thyroid, maybe you've got an adrenal imbalance and we need to look at diet for the adrenals. Maybe you've got issues with your gut and we need to look at that. So there's lots of different areas. It's not just thyroid specific that we need to look at. Also, we can use targeted supplements to help support your thyroid function and these other parts of your body, as well as your overall health. When we do find these specific root causes, we can use these targeted supplements and nutraceuticals to bring your body back to balance. The gut in particular has been linked to thyroid function. There's lots of growing evidence around this. And we pay close attention to gut health. We'll address any dysbiosis, leaky gut, any other gastrointestinal issues that may be going on that will impact thyroid function, as well as looking at your whole endocrine system. Because at the end of the day, thyroid, we're looking at hormones. So we also need to look at your adrenal hormones, your sex hormones. We need to really pull in the full picture of the endocrine system. And a lack of focus on many of these areas, or maybe all of these areas in some of the patients that come to me, can be the reason why you're not seeing the results you hoped for when you started taking your medication, or why you're just really feeling kind of lost in that road to recovery. And if you are struggling with ongoing thyroid issues, you may be sort of grappling with a range of these emotions. And these emotions can be really challenging. Many of my patients have shared experiences with me, shared stories, and often they kind of echo the same frustrations and feelings amongst thyroid patients. So many of them are having these shared sentiments, really feeling the same emotions that many other people are. So if we take a look at some of the things that my patients have explained to me, so feeling unheard and dismissed, this really is a recurring theme amongst my patients. Many express that their persistent symptoms are often overlooked or not taken seriously, especially if their lab results appear within that normal range. This is a really big one for those people. And that they can kind of feel dismissed. It feels them leaving kind of invalidated, unheard, as if their experiences and concerns are kind of being disregarded. Additionally, those sort of rushed appointments kind of only add to the sentiment. Generally when you go and see a doctor, you don't have that much time with them. You have quite a hurried consultation. And that can sort of further this feeling of being dismissed, even if you're not necessarily being dismissed. You can feel that way if you really haven't had a chance to get your worries out and really feel like they're being fully addressed. Another one that I hear so many times is experiencing frustration and hopelessness. So living with these continuous symptoms that despite receiving treatment, it can just really lead to immense frustration, that hopelessness, because patients often describe feeling trapped in this kind of cycle. They're not really seeing the improvement that they wanted. And that lack of progress can be really deeply discouraging. It can actually erode their confidence as well. A lot of my patients say that they feel like they've lost confidence. And that can be really difficult when you're trying to heal and trying to recover. And it can really make them to feel stuck in this kind of unending struggle with their health. Another one that I hear all the time is feeling confused and overwhelmed. So navigating the complexities of thyroid conditions, it can be really confusing, especially when patients are maybe receiving conflicting advice from different healthcare providers. There's still many doctors out there who will say, oh, you don't need to do anything with your diet. Diet doesn't come into it. And I regularly hear from my patients that they just really don't know where to turn. They don't know what to do next. And that inconsistency of information can be overwhelming and really leave you kind of feeling uncertain about the next course of action to take. Additionally, the nature of thyroid diagnoses is that they are very intricate. There's a lack of understanding or comprehensive support around explaining thyroid diagnoses to people. And that can really lead to people feeling kind of that sense of bewilderment or being overwhelmed or even more stress, which is only going to further impact the adrenals and the thyroid and the autoimmunity. So, we really don't want these feelings. They're just exacerbating the illness that you've already got. Another one that I hear regularly is experiencing isolation and loneliness. So the lack of support in healthcare can lead patients to feeling isolated. They can feel quite alone in managing their condition. And that sense of isolation is often kind of compounded by the social impacts of your symptoms. So you may be experiencing fatigue, you may have weight changes, mood swings, all of these things that maybe make social interactions more challenging and can sometimes lead people to feeling more lonely, from disconnecting with others. They maybe don't want to socialize as much. And many of my patients also describe their family and friends not really understanding their symptoms. And it can be really hugely beneficial to have somebody on your side who knows what you're going through. And functional medicine focuses in on this support. My programs are all designed to give you ongoing support. So you've always got somebody who can talk to you about that journey in a way that maybe people who haven't been through thyroid or autoimmunity, they just really can't quite understand. And then that can lead to, and this is another one I hear a lot, people grappling with kind of anxiety and feeling uncertain around their health and their future. That could be a real source of anxiety for patients. And the fear of the unknown as well, coupled with, really things haven't been explained to them well enough. They don't really understand their diagnosis enough. They don't understand what options are out there for them, how they can help themselves. All of that uncertainty can really lead to this kind of pervasive anxiety that can overshadow your daily life. So it might make it really difficult for you to, be finding peace and finding clarity. You may be functioning well. We can have high functioning anxiety. So you may be managing to function and still do things through the day, but it just might not be as comfortable and as easy and as peaceful to do things. Then the other one I hear a lot is feeling very physically and emotionally drained. So if you're not feeling necessarily anxious, it may be that you're just feeling really exhausted with anything. Persistent symptoms like chronic fatigue and pain, they can really deplete a patient's kind of physical and emotional energy. So it can really leave you feeling drained. And the impact on your daily life then can be really profound. You can struggle then with everyday activities, you can struggle with your responsibilities. And this battle can really lead to burnout. So we know that, stress leads to burnout, which leads to chronic illness. And that's why I do the work that I do around stress and optimal health and burnout, as well as working with people who have these energy and immune disorders, because it works both ways. A lot of people will have stress and burnout first, and that will lead to a chronic illness and diagnosis because they push through. Likewise, the other way around, it can become a vicious circle, because once we've got that diagnosis, once we've got that autoimmunity, we've got a thyroid condition, actually just the stress of all of that can lead to burnout as well. So really, stress is very heavily interlinked into all of this. And, burnout is something that we have to be really careful of, and we need to make sure that we are watching for, because many, many of my patients do say that they feel physically drained, they feel emotionally drained, and that can be really difficult. And again, with this, we need to make sure that we're looking at the body as a whole. The adrenals very heavily linked to the thyroid, the mitochondria very heavily linked, the brain's very heavily linked. A lot of people think that actually your thyroid is what needs dealing with, but actually it's your brain that controls the thyroid and how much hormone is released. So your brain plays a really important part in this. So brain fog can come into play. So really important that we're addressing all of this. How does the functional medicine approach differentiate from the standard conventional way of dealing with things? So in functional medicine, every symptom is taken really seriously, and it's not just dismissed if you've got, normal on a lab result. We don't care if you fall within the normal range. That normal range may not be right for you. So we really need to individualize things. We're going to take a really detailed attention to your experience. We're going to really validate your experience and how it's been for you. Make sure that you feel like you've been genuinely heard and understood, and your individual story has come into this. We do this with extended consultations. So we really, you get at least an hour. The first consultation with me is 90 minutes. And we're really going to delve deeply into your health history, your symptoms, your lifestyle factors, really make sure that every concern is being fully considered and addressed. And that comprehensive approach can sharply contrast with that kind of rushed and quite short interactions that you've previously maybe had with practitioners. And that really helps to give you that sense of kind of understanding. That's the other thing. We're going to really make sure that you understand your condition and your health journey. Functional medicine also has this really personalized care model. That can actually be really empowering for patients. You become a really active participant in your health journey. And this is really important. We'll get onto that in a moment. But by tailoring your plans to you as an individual, you actually get a deeper understanding of your condition and your factors that are influencing it. So education is the cornerstone of this approach. And patients are really equipped with knowledge about their thyroid condition, what options are available to them, the necessary lifestyle modifications that you need to make. And that empowerment actually makes you feel like you're taking back control. And that education enables you to make those informed decisions and take charge of your health. And that can really foster that greater sense of control and agency that can be lacking in conventional care. In functional medicine, we're also going to be looking at identifying and addressing those root causes of your thyroid issues. So really looking at inspiring hope for long-lasting improvements. So instead of looking at just managing symptoms, we're looking at what's going on for you in your body. We're going to consider all aspects of your well-being, diet, stress, sleep, so much more, and give you the confidence to really get those better health outcomes. We're also going to look at what's been going on for you specifically. So not just what happens in thyroid conditions, but what's actually happened in you that's led you to getting this thyroid condition. We also focus heavily on ongoing monitoring, regular follow-ups. It's really integral to the functional medicine approach. It ensures that you feel supported. It allows for adjustments based on your progress as you move through plans. And it also gives that kind of multifaceted support. So it extends beyond medication. We're looking at lifestyle factors, we're looking at diet, and really getting that sort of all-encompassing care that gives that profound sense of support. And that's really important. And then we're looking at that sort of effective symptom management and overall health improvements. So patients often actually report that they've got enhanced physical, but also emotional well-being as their symptoms have become more effectively managed. This is not just looking at lab results. This is looking at your symptoms and is anything lingering? Are you struggling with certain things? And this can lead to really significant improvements in things like your energy levels, your mood, your daily functioning. You then get that better quality of life. If we can reduce that anxiety, you're going to start socializing better. So your quality of life becomes better. And that's really important in functional medicine. We're really focusing on getting you the best quality of life that we can get you with the condition that you've got. So I want to just look a little bit specifically at Hashimoto's, because Hashimoto's is the most common thyroid condition out there. And a lot of these things will relate to all thyroid conditions, but Hashimoto's is the most common one we see. So I just want to kind of dig into Hashimoto's a little bit, and some of those roadblocks, some of those sort of obstacles that patients with Hashimoto can come up against when they're trying to find an effective path to management and recovery. And the challenges with Hashimoto's tend to be rooted within the complex nature of the disease, the fact that we've got that autoimmunity in there as well, and also the systemic issues. So we really need to be looking at that whole body. Some of the main roadblocks that I hear a lot with patients with Hashimoto's is a delayed or actually inaccurate diagnoses. So Hashimoto's thyroiditis, it can kind of present as a spectrum of really non-specific symptoms. So things like feeling a bit depressed, feeling low in energy, some weight gain. These things can be put down to many different conditions. So sometimes diagnosis can be delayed. It can also lead to misdiagnosis sometimes as well. But part of that problem comes from that focus on lab tests of just looking at TSH and potentially T4. And that may overlook the critical presence of those thyroid antibodies, TPO and TG antibodies, which actually show up before your TSH will become imbalanced. You have those antibodies, particularly with autoimmunity. Antibodies, they show up so long, they can show up decades before you actually get to that disease state where your function tests, so your TSH and T4, T3, would become imbalanced. So that can be a real problem with getting diagnosis. So the limited testing with Hashimoto's can be a real problem with getting an accurate diagnosis quick enough. Another thing with diagnosis as well is that sometimes people have been told that they're hypothyroid, but haven't been told that they've got Hashimoto's when they have. And like we said before, 90% of people with hypo are Hashies. So really important, if you don't know, if you haven't actively been told that you are not Hashimoto's, you need to investigate whether or not you are. The other thing with Hashimoto's is that kind of lack of comprehensive care. So once diagnosed, the care tends to focus on normalizing TSH. That tends to be the main focus that you will get with Hashimoto's. You generally are not going to get much support in that underlying autoimmune activity unless you're looking to somebody that's working in functional medicine. You may have been sort of prescribed your, synthetic T4, your levothyroxine, but that might not be sufficient for everybody. There are also alternatives out there, things like T3. You can get that in some areas. You can't get it everywhere, but that is an option. And there are charities out there. We've done a podcast episode previously with the Thyroid Trust. They are advocating for more use of T3, making it more available for people. So that's definitely something that you should be aware of. You should look into. Is it available in your area? Is it not available in your area? Is there a charity you can get involved with where you can try and advocate for it being available for you where you are? So all of these other treatment strategies, really important to be aware of as well. And not just sort of accept that there's one drug that's going to do it all. The other thing with Hashimoto's, dietary and lifestyle factors tend to have not really been talked about. And Hashimoto's patients with Hashimoto's frequently struggle with nutritional deficiencies. So things like selenium, zinc, vitamin D, really common that you're going to have deficiencies in those. And they are really crucial for thyroid function, as well as your overall health. But the deficiencies are often overlooked in sort of standard care. And we also have to consider dietary triggers. So things like gluten and dairy can exacerbate symptoms. Even if they're not exacerbating symptoms, so you're not necessarily noticing an effect when you eat them, they can be acting as a root cause and actually triggering flare-ups of the autoimmune thyroid conditions. So identifying and eliminating what these are, that is really important and can actually be really daunting if you haven't got the right guidance on how to do it, because these things do need to be done in a particular way. And then we have your lifestyle factors. So stress, as we've already talked about, really big impact, particularly on autoimmune conditions. Sleep as well, exercise, these all play a really crucial role in managing Hashimoto's, but they're often neglected or inadequately supported, or you haven't been told that they're even going to make a difference. Then we've talked a little bit about the gut as well. The gut's really coming through as being an issue for Hashimoto's. Many patients with Hashimoto's will suffer from gut permeability issues. So you may have heard this commonly talked about as leaky gut syndrome, but leaky gut, intestinal permeability, whatever you want to call it, these things can really intensify those autoimmune responses. So these gut-related factors are rarely addressed as part of a treatment plan in conventional medicine, but really should be part of healing. And we really do look at those within functional medicine. Additionally, we're going to look at things like imbalances in your gut microbiota, dysbiosis, any inflammation, how's your immune function working? So all of these we can get from examining the gut. And then that autoimmune component that we've already talked about, it's a significant challenge in Hashimoto's to manage that autoimmune nature of the disease. And, conventionally, that's not looked at. It's not, the autoimmune processes really are not considered. And they are actually what is driving the condition. So, and actually as well, patients who have got one autoimmune disease, if you've got Hashimoto's or Graves for that matter, you're actually at an increased risk of developing additional autoimmune disorders, and that can further complicate your recovery. So really important that you know if you've got this autoimmune, that you are working on that autoimmune, you're balancing out the immune function. So we don't want you starting to collect these conditions, which is really commonly known that happens. When you've got one autoimmune disease, it's really easy to start collecting them, which we don't want. Another thing with Hashimoto's is looking at these environmental toxins. So we know that pesticides, heavy metals, endocrine disruptors, they can all exacerbate thyroid dysfunction and autoimmune responses. So this is really important whether you've got the autoimmune or not. It's more important if you've got Hashimoto's. So despite their significant impact, rarely within a conventional setting will you be told about environmental toxins. But that's something that we really will look at and navigate within the functional medicine system. It is really important as well that we look at patient education with Hashimoto's. It's really important that you understand the condition. It's a complex condition. It's got a really complex underlying autoimmune side to it. And it is really, really important that you know what's going on so that you can work on all parts of the condition, all parts of your health. That's really important. So education is super important in Hashimoto's, really being able to understand it. And that is also going to really help with that emotional and psychological impact that we talked about. And one of the big things I think for Hashimoto's patients that causes an issue is, and we touched on this just before, is we mentioned those persistent symptoms. And that can be something that can really play a part in people with Hashimoto's. It can play a part in people with Graves as well. But taking your medication and finding that actually those symptoms are still there, but you're being told now that you're taking your medication, lab results are back in the normal range and you're fine. But those persistent symptoms just don't go away. And that can be really disheartening and also lead you to think that that's how you've got to continue living, that's not going to change. And that's not the case. You can still work on these things. You can still bring them down. You can still live a better quality of life. There are things that you can do. And patients with Hashimoto's may find that certain symptoms are particularly stubborn or difficult to recover from. And the ones that we hear as the most sort of challenging symptoms that are the most persistent, fatigue. This is always, chronic fatigue is one of the most common and debilitating symptoms with Hashimoto's and can persist even after thyroid levels have been normalized with your medication. So often, it's due to underlying issues. It's due to mitochondrial imbalance. It's due to adrenal imbalance. It's due to nutrient deficiencies, or it might be due to ongoing inflammation in the body. So really important that you are looking at that full picture. And then another one that is commonly known for being particularly stubborn is that weight gain with Hashimoto's. So it's really common that you get metabolic slowdown, and that can lead to difficulty in losing weight or unexplained weight gain, which can be particularly stubborn. And hypothyroidism, so not just Hashimoto's, hypothyroidism slows down your metabolism. But when you've got Hashimoto's, particularly, and this can happen actually just with people with hypothyroid as well, but even more so in patients with Hashimoto's, actually those hormonal imbalances, those metabolic imbalances can all further exacerbate the autoimmunity. So it can really lead to this kind of ongoing cycle that can be really difficult to break. The third one that tends to linger is that brain fog. And we've talked about the involvement in the brain, but that cognitive issues, so problems with concentration, with memory, with mental clarity, these can all persist despite your levels being back normal. So brain fog might be influenced by your thyroid hormone levels. So medication can help, but it might also be impacted by inflammation, by nutrient deficiencies, by gut health issues. The gut is inextricably linked to the brain. You have this nerve that runs from your gut straight to your brain. So the two are very, very interlinked. So yes, working on thyroid hormone levels is going to help with the brain fog, and getting those levels normal with the medication is going to help. But you might be one of the people who's got inflammation going on in the body. You might have nutrient deficiencies. You might have gut health issues. Then that brain fog is going to become persistent and is not going to alleviate just with medication. Another one is depression and anxiety. So mood disorders really common in people with thyroid imbalances. And the stress of dealing with a chronic illness can further exacerbate this. That can lead to changes in brain chemistry. Also, autoimmunity plays a part in depression and anxiety. So if you've got Hashimoto's, you're going to be more prone to having that as a lingering symptom. Another one, and this is one that really emotionally impacts people, is hair loss. So thinning hair can be really distressing for people with Hashimoto's or with thyroid dysfunction. And sometimes that just doesn't repair just from taking the medication alone. There could be other imbalances going on in the body, and they need to be investigated to figure out what the root cause of that hair loss is. And we've done other posts on Instagram and other podcast posts on underlying causes of hair loss. So you can find that podcast episode and have a listen back to that one. Other symptoms that really can sort of linger and be persistent, things like your joint and muscle pain. So that can be due to ongoing inflammation. And that can also be exacerbated by other autoimmune conditions if there's other things going on, and lifestyle factors. Cold intolerance as well. So many people with Hashimoto's will have that. That can be slow to resolve, and that can be, again, due to that slowing of the metabolism, impaired circulation. So again, things that are not going to just repair with, thyroid hormone replacement. Digestive symptoms, so gut problems, they can be persistent too. Constipation, bloating. Those symptoms can really be linked to that intestinal permeability, to gut dysbiosis, and the effects of thyroid hormones on your gut motility as well. So all things that need to be looked at. Sleep disturbances as well. So things like insomnia, restless sleep, they can be particularly difficult to manage. Again, linked to hormone imbalances, linked to stress, linked to anxiety. Some people get restless leg. That can be linked to nutritional deficiencies. So there's lots of different things that can be going on with sleep, and we need to look at that, because if you're not sleeping, that's really bad for your autoimmune side of the condition. And then things like swelling as well, puffiness, so edema. Some people with Hashimoto's will find that they get some edema, maybe around the eyes and the face. That can be quite common. That can be due to that poor lymphatic drainage or to fluid retention. So all things that need to be looked at that are not going to be addressed just by taking medication. So we're going to address these symptoms through really thorough evaluation, through nutrient support. You're making sure that we're looking at that selenium, the zinc, the vitamin D, B vitamins, iron, all of those things. Dietary changes, so looking at anti-inflammatory diets, potentially looking at whether we need to eliminate any food, especially with the autoimmune aspect, with things like Graves' and Hashimoto's, looking for food sensitivities, supporting that gut health with prebiotics, probiotics, looking for underlying infections and dysbiosis, looking at that stress management, incorporating stress reduction techniques, things like yoga, mindfulness, exercise, you make sure we're getting that adequate sleep in there, plenty of regular physical activity, helping to support and boost that metabolism and also your mood. That can be really important. And then specifically looking at that autoimmune management, so modulating the immune system. And all of these things are really, really important if we're going to take a proper and thorough approach to managing your thyroid condition. And we did say that we would just touch as well on the importance of being an active part of your healthcare. And that really is key in functional medicine. Being an active part of your healthcare can really significantly empower you as a patient in many different ways. It can lead to better health outcomes. It's been proven in studies, in trials, studies have shown that if you are an advocate in your own healthcare journey, that leads to better health outcomes and an overall improved quality of life. So some of the key benefits and the powers that are gained from being an advocate in your own healthcare, are things like increased knowledge and understanding. So being able to make informed decisions, that really helps you. It really is important. If you've got the knowledge, you can make an informed decision. If you've got some knowledge as well, you can also then start to really self-educate, learn more about your health condition, learn more about those treatment possibilities. And that can be really empowering. We've got those improved health outcomes because if you understand things, you are going to adhere to the treatment better. If you're going to actively stay doing things and adhering to protocols because you know why you're doing them, and that's really important. Also, we're going to get better early detection because you're going to be really vigilant about being able to pick things up yourself. You're going to notice changes in your symptoms. And this is something I see from my patients, and I get feedback from patients a lot, is that they are now much better at picking up when things are flaring up slightly, so they can jump on it early, and they know then they've got the toolkit, they know what to implement to stop things from becoming a full-blown flare, to stop things from getting worse. And that's really important and very empowering. It also allows you better communication with healthcare providers. So if you are an active participant, You can actually have a collaborative relationship with your healthcare provider. You can better communicate how you're feeling. You understand things better. And that really, really helps when you're talking to practitioners about your care. It can also give you more control back, more autonomy. So those feelings of helplessness and dependency, they can start to disappear. And you can start to feel really responsible for the decisions that you're making in your healthcare. And that really helps with improved mental and emotional well-being. So it can help to reduce that anxiety. It can build confidence again, really help you get out there and living your best life again. And that's really what it comes down to. It also allows you to actively partake in personalized plans. And that's really important to getting those better, improved results. It also allows you to look at prevention as well. So preventative measures and maintenance of your condition and knowing how to do that. So as we've just said, with patients, being able to spot when things are flaring up, being able to look for flare-ups, look for any complications, look for anything that might be worsening, or picking up on any potential future autoimmunity that's coming into play. So all of that is really important. So being an active participant in your healthcare really, really enables you to focus on a personalized care, to strengthen your advocacy, and also helps you to stick to things better if you understand why you're doing them. I hope that has been really helpful for you in understanding how to navigate a thyroid diagnosis once you've been given one. We will be back next week with another episode of the Good Health Podcast, and I look forward to seeing you then. I hope you enjoyed this episode of the Good Health Podcast. Do share the episode with anyone who you think it may benefit or who may enjoy it, and help me spread the word by rating the episode or leaving a review. If you want more, you can find other episodes in the series on your podcast app or sign up to my free newsletter. Not only will you get information on new episodes launching, but we cover lots of health topics with the Ask Nicole section where you can send in your questions, my favorite recipes, my favorite products, tips and tricks to help you on the road to good health, and much more. You can sign up free of charge at nicolegoodhealth.com/newsletter, also linked below. I hope you have a lovely week. Don't forget to hit subscribe, and I'll see you next time.